The study was conducted to analyze surveillance data from 2015 to 2023. Every information was collected from different sources, including basic statistics, infection rates, and transmission estimation to study the disease. It is found that 995 confirmed rabies cases in animals, especially in Sarawak. As I was saying, Sarawak is recorded for having the highest number of cases, which is 97.99% from confirmed rabies cases in Malaysia, and 89.35% are made up by dogs. It is also quite concerning due to average yearly vaccination rates was only 16.66%, which is much lower than the 59.05% needed for herd immunity. I believe that the connectivity between rabies cases and vaccination rates, highlighting the urgent need for better disease control and public health measures.
Hi, my name is Asma. I will be presenting the chronology of rabies disease in Malaysia, with how it was discovered, its recognition in medical history, and the government's efforts in managing and reducing its prevalence. Firstly, in pre-20th century, yearly reports and limited documentations. Rabies likely existed in Malaysia for centuries, but was not well documented due to limited medical records. Traditional beliefs and remedies were used to treat animal bites, but rabies was not scientifically understood. There were no official control measures to prevent rabies transmission. In 1950 to 1970s, first documented cases and initial control efforts. Rabies cases began to be officially recorded in Malaysia as modern veterinary and medical services improved. The disease was mainly reported in wildlife and stray dogs in rural areas. Meanwhile, in 1970s, the Malaysian government started vaccination campaigns for pets and stray animal control programs to prevent rabies outbreak. In 1950s to 1990, rabies-free declaration and isolated cases. By the late 1980s, rabies cases had significantly declined, and Malaysia was declared rabies-free in 1999. Occasional cases still appeared, mainly in border areas near Thailand and Indonesia. The government strengthened border surveillance to prevent rabies from re-entering the country. In 2050 to 2070, rabies outbreak in Sarawak. In July 2017, a rabies outbreak was reported in Sarawak, making the first human rabies cases in Malaysia after nearly 20 years. The outbreak was linked to infected stray dogs from neighboring regions. The Malaysia Ministry of Health, MOH, and Department of Veterinary Services, DBS, launched mass dog vaccination campaign and cooling operation to contain the outbreak. In 2018 to 2020, government action and public awareness. In 2018, the government implemented the National Rabies Control Program, focusing on mass rabies vaccination of pets and strays, public awareness campaign to educate communities on dogs bite prevention and post-exposure treatment, border control measure to prevent infected animals from entering Malaysia. In 2020, despite these efforts, rabies cases continue to be reported, particularly in Sarawak and Sabah. Next, in 2021 until present, continued monitoring and new strategies. In 2021 to 2023, Malaysia intensified efforts to eliminate rabies through increased vaccination efforts targeting 70% of the dogs' populations, stronger penalties for unvaccinated pet owners, collaboration with international health organizations for improved rabies surveillance. In 2024 onwards, ongoing monitoring research and education campaigns to achieve zero human rabies cases.
Did you know there are 5 stages symptoms of rabies? Incubation, prodrome, acute neurologic period, coma, and death. Rabies causes due to the bite or scratch from an infected animal. There are no symptoms during this period, but the virus is spreading to the nervous system. The closer the bite to the brain, the sooner the effect likely to appear. fever, headache, nausea, fatigue, loss of appetite, anxiety, and pain at the bite site. This stage, where the virus already reached the brain, causing several neurological symptoms. Patients typically develop one of two types of rabies, which is spurious rabies, hydrophobia, hyperactive, hallucination, and paralytic rabies. Loose coordination, difficulty to swallow, paralysis at bite site. Worsening paralysis can lead to coma, breathing and heart function become erratic, respiratory and organ failure to begin. Death usually occur due to the respiratory failure. Extremely rare survival may have lasting brain damage.
Rabies is caused by infection with the rabies virus. The causes of rabies can be categorized based on different modes of transmission and sources of infection. The most common source of rabies comes from infected dogs, especially the stray and unvaccinated dogs. When an infected dog bites a human, the virus that presents in the dog's saliva will enter through the wound, and it will travel through our nervous system, and this will affect our brain. Cats have also been identified as carriers of rabies through its bites and scratches, particularly by infected stray cats. Rabies can also be transmitted if the saliva of an infected dog or cat comes into contact with an open wound or broken skin. This transmission is less common than bites, but remains a risk, especially for individuals who handle stray animals or rabbit pets, especially without proper protective measures.
Rabies is a deadly viral disease that affects the nervous system. It is almost always fatal once symptoms appear. That's why immediate treatment after exposure is crucial. If someone is bitten or scratched by a potentially rabid animal, the first step is immediate wound care. The wound should be washed thoroughly with soap and running water for at least 15 minutes to remove as much of the virus as possible. After that, the person must receive post-exposure prophylaxis or PEP. So, what is PEP? PEP is a treatment given after exposure to the rabies virus to prevent the disease from developing. It includes two important components. First, the rabies vaccine, a series of 4 to 5 injections over 2 weeks to help the immune system fight the virus before it spreads to the brain. Second, rabies immunoglobulin, RIG. This is given only if the person has never been vaccinated before. It provides immediate antibodies to neutralize the virus of the site of the wound. PEP must be started as soon as possible, ideally on the same day of exposure. If treatment is delayed and symptoms start to appear, rabies is almost always fatal, with no known cure.
Hey guys, today I will explain about the precautions. First, avoid contact with stray or wild animal that has rabies. The person need to recognize the symptom of rabies such as unusual aggression and lack of coordinations. The person also need to keep the distance between the wild or stray animals and not touch or feed them. Second, vaccinate their pets. As we all know, vaccinate is the injection that contain the inactive virus that given to the pets to help their immune system fight off the rabies virus. This injection usually given at 12 until 16 weeks of age of the pets. Last but not least, immediate wound care. The person who get the bite or scratch from the rabies animal need to do these methods. The person need to wash the wound immediately. Rinse the wound with the running water and soap at least 50 minutes. use the antibacterial soap to remove the virus and avoid scrub into hearts because it can help virus spread deeper.